We all have men we care about, but are they taking good care of themselves? Do you know what the main health risks are for men and what the most common sexual health concerns are? Well, you will if you join us for It's Your Call right now. Well, I certainly hope I've gotten your attention with the title of our show because we have some very important health information to share with men and those who love them. Hello, everyone. It's good to have you with us. I'm Lynn Doyle. You know, once a year, Father's Day comes around and we all wish the very best for the dads in our lives. But they need to be taking care of themselves every day of the year, not just on Father's Day. So my first question to you is, are the men in your life doing that? Well, hopefully the answer is yes. But if a man in your life is overweight, if he smokes, if he has high blood pressure, or if he's lost interest romantically, shall we say, he may be experiencing health issues and not sharing them with you. This hour, we hope to give you some insight into men's health and how it is totally connected to their sexual health. Here to help us do that and to answer some of your questions later in the show are today's guests. They include Dr. Jay Block, who is a urologist in Voorhees, New Jersey. That's a suburb of Philly. He's been practicing urology for over 25 years. Dr. Donnie Patterson is a family physician and the director of medical community outreach at Einstein Healthcare Center in Philadelphia. And Dr. Deborah Lano is a certified sexuality educator and sex therapist practicing in Delaware and consulting nationwide. Ladies, gentlemen, it's so nice to have you with us. Thank you so much for providing much needed information.
Thank you for having
me.
me.
Good to see you. I want to start with you, Dr. Patterson, and talk about men's health care routines in general. I tend to believe that the guys in our lives just don't take health care as seriously as perhaps we do as women.
It's very true. Some men do come in, but they often feel too busy or they're embarrassed, so often they don't come in.
And what's the impact of that if they don't seek medical assistance?
Well, heart disease is the #1 killer of men and women, actually. And 800,000 people every year die of heart disease, and so those are men and women that we're losing.
So let's talk about heart disease right then and there. If it's the #1 health issue for men, what are some of the symptoms or warning signs that we might put out there right away that people should be aware of?
Sure. So a lot of people think that they have to have the crushing chest pain or the pain down their arm to have heart disease, but that's not true. So heart disease is just when you have inflammation in the blood vessels that lead to your heart, and it could be caused by high blood pressure, diabetes, high cholesterol. So if people have any of those things, they really should talk to their doctor before those symptoms happen.
But they have to know that they have them. It's kind of like a catch-22, isn't it?
Absolutely.
Because if they don't come in for a regular routine medical checkup, you might be living with these afflictions and not really realize it.
Absolutely. I preach to my patients at Einstein, make sure you know your numbers. People have to take responsibility for themselves. They have to know their blood pressure. They have to know their cholesterol. They have to know their sugar. Those are very important numbers, and you need to know them for yourself.
All right, I'm going to put that challenge out to you right then and there. Do you know all of that? Do you know your blood pressure? Do you know your sugars? Do you know all of the things that Dr. Patterson just pointed out? If not, you need to make an appointment right away. If you have questions or comments, you can email me during the show at lynn@lynndoyle.net, and we'll see if we can get you some answers. I want to turn to Dr. Block here because
you want to know what your cholesterol is.
Absolutely, I said that.
Right.
Absolutely, your cholesterol. I want to turn to you because a lot of times some of these general health issues might actually lead to some problems in the bedroom as well. Is that correct?
Well, certainly cardiovascular disease is associated with erectile dysfunction, diabetes, and so forth. Yeah.
So what can you say to men to encourage them then to get these regular checkups? Do we use the threat of impotence or low testosterone or not getting a response in the bedroom as almost like an impetus to get them to come into the doctors?
Well, hopefully they'll see the show and be motivated to take better care of themselves. And of course, diet, exercise, and regular checkups.
And what are some of the most common problems that you treat as a urologist?
Well, we see problems of the urinary tract in both men and women, and in men the genital tract as well. So we see problems of the kidneys, kidney stones, kidney cancer, bladder cancer, prostate cancer, of course, which is very common, erectile dysfunction, urinary tract infections, BPH or prostate enlargement, which can affect urination. So those are the primary things that we see.
Okay, so let's talk a little bit about prostate checkups, because we've been hearing that in the news recently. That's something that, you know, people make conversation about because it's probably one of the things that people are more familiar with than some of the others that you might have mentioned. So how common is prostate cancer at this point?
So prostate cancer is very common. Oftentimes there are no symptoms, and when men do have urinary symptoms, it's more often due to benign prostate enlargement, not cancer. So it's diagnosed typically from a PSA blood test, sometimes from a digital rectal exam to examine the prostate directly, but one can't rely on symptoms typically to diagnose prostate cancer. You have to see your doctor.
There was a lot of controversy at one point about whether or not men need to have this test on a routine basis, just like there was some question whether women should be having mammograms on a regular basis after a certain age. What would your recommendation be?
Well, there is some controversy, and mostly the controversy was, do men need the finger, the digital rectal exam? And that's falling away from favor. But we do still recommend men getting the PSA blood
There was
work.
a collective sigh of relief in the room.
Absolutely.
I don't know if you could hear it.
Absolutely could hear it from miles away. But also, this is a time to emphasize to people they really need to know their family history. You have to know it. If your father or your grandfather has had prostate cancer, your family doctor really wants to know that.
So it's very much like women. We need to know our mother's family history as well, and whether or not we could be, you know, prone to having certain diseases. So men, you have to take your health as seriously as you expect us to take our health. If you'd like to be part of our conversation, we'd like to invite you to join in. Go ahead and send me an email and tell me what types of health issues you or a man in your life are dealing with, and how you are dealing with them, how you came to be aware of them, and what kind of impact it's having on your life. We'd also like to know about the prescriptions that you're taking, because there seems to be this huge increase in these prescriptions for ED and low T. We want to know whether you're one of those people taking that. And quite frankly, we're asking if sex is an issue at times for you, if it's because of a health issue. If you have any of these questions or concerns, email me directly. I'm at lynn@lynndoyle.net. You can also find us on Facebook, and of course we're going to talk about this on Twitter. Oh my goodness, the followers we'll get on that. Dr. Deb, it's always great to have you here. We said that we wanted to talk about men's health in general, but it's probably the graphics that say men's sexual health that'll get them to stop and pay attention for 5 minutes. How common are sexual health problems?
Sexual health issues are very common with both males and females. You know, ED being, you know, one of the primary ones that everyone hears about. There's certainly other ones out there as well, but you know, for the sake of, you know, our discussion, you know, here today, and you know, some of the low testosterone issues and some of that stuff that's, you know, going around in debate in the medical community as well as other communities, you know, we'll stick with that. So it's common.
Okay, well, we want to talk about some of the things that we're seeing when it comes to men's sexual health. I mean, is it my imagination, or are the television ads just totally overloaded with commercials for Viagra and other sexual or erectile dysfunction aids? Is that just me?
Now the new one is androgel.
Right, we're going to talk about that. But I mean, do you see that?
It's everywhere, but as you said, it's the thing that gets men's attention. And it's happening at younger and younger age, because high blood pressure and diabetes are happening at younger age. Then these men are getting sexual dysfunction at younger ages. So it's very common.
Now that collective sigh of relief just all of a sudden was a big intake of air, because they're like, what? What do you mean younger men are having this? Well, if you want to know more about it, we're going to have to take a break, but you're going to have to stay with us to find out. If you do have questions for the doctors, please email me during the break. We're going to answer some of your questions and provide much more information when we come back. Stay with us. Sorry, Debbie. Welcome back, everyone, to this edition of It's Your Call, where we are focusing our attention on men's sexual health issues. If you have questions or comments, we're going to answer some of those in just a couple of minutes, but you still have time to email me at lynn@lynndoyle.net. I want to go back to Dr. Deb Leno, because we were talking a little bit about ED, erectile dysfunction, and also low T. These are two things that seem to be dominating the airways, particularly if you're watching like the US Open, for example,
Sure,
or
right.
any golf tournaments. NASCAR, every time I'm watching a sporting events, I'm like, well, they are definitely sending a message to these men. So is
Yes.
it really that common, or is it just a new marketing ploy?
I think that there's probably a combination of both there. It is becoming more and more common, as Donnie said, that there is more and more younger men being diagnosed with erectile function issues and low testosterone. So there's definitely something that's happening, and I could go on and on and on for why those reasons are. But the reality is that we are seeing more of this stuff diagnosed in younger as well as older males.
Any indication as to why?
I am a big proponent of looking at the origin of health issues and what's actually happening, what people are putting into their bodies, what they're not putting into their bodies, exercise, even supplementation. We have an epidemic of low zinc, with males in our country specifically.
So ED is not just an older man's issue anymore?
No, isn't that interesting?
And I know this is going to sound like the dumbest question ever asked on television, but it's not, because there's a reason for it. What are some of the symptoms or some of the warning signs that go along with ED? Obviously, the dysfunction is the first thing, but are there other warning signs or signs that this is what the problem is?
Well, heart disease, and I think you guys had mentioned that here on this platform earlier, but heart disease or ED is one of the, is the primary, or heart disease is the primary, cause, or one of the primary causes of ED. So we've got overall, cardiovascular health that goes into that as well.
So to your point, you were saying, what are some of the symptoms? A lot of times guys will say, I don't have the same libido. They don't have the same energy, the same interest in it. And then their erections may not be as firm, or they don't last as long. And so oftentimes that'll be how it starts.
And to that point, I also want to say that as men age, there is going to be a difference with regards to firmness of erections. I mean, that is just, part of aging. So that kind of stuff has to be taken, into consideration as well when looking at erections. But low libido goes into the low testosterone issues, right? So and there's other things that can come into that, like when you take a psychological approach. We've got relationship issues that can be causing ED. They're not all they're not all physical health issues as well. They can be certainly psychological, relationally, emotionally.
See? I told you it wasn't a stupid question. There was a reason that I asked it.
And sometimes you see people, they complain that they can't maintain the erection, but with a good sexual history, you find that the actual problem is premature ejaculation, and the erections are actually fine. So,
and then on that note, you find out that their partner's not a good lover. So you've got those issues to look at. So, when we look at erectile dysfunction or erectile function issues, I like to kind of put that positive spin on it. There's so many things that go into it.
Well, we don't have enough time to talk about who's a good lover and who's not. That could be an entire show unto itself.
That could be a few shows.
It really. But now that I've asked the questions, now we're going to give you an opportunity to ask some. Let's see what our first one is. It says, is there such a thing as male menopause? My husband is acting worse than me when I was going through it. He's 58, 30 pounds overweight, and totally not interested in sex. He's snarky too. I love her. Should he take hormones or something? This comes from Andrea.
Andropause, right? Go ahead,
so,
Donnie.
I mean, definitely there are people who believe in it, they don't believe in it, but it's real. It's real. So men have hormonal changes as well.
So andropause is not the name of a medicine. It's actually what is referred to when men are going through the change of life.
Yes, yes.
So welcome to our world.
Yes.
Sorry.
So they have this hormone change, and it often comes with some depression, some anxiety, and some erectile dysfunction, and it's often started with stress. And so it's real.
But men probably don't think of themselves as going through menopause. Like, we've always been talked to about going through the change, but are men discussing that with you, doctors?
I think probably the most common symptom we see would be lack of energy. And
bone loss, as well. I mean, bone loss goes in with that as well. So, and men don't think about bone loss. Women think about bone loss, right? Or bone density loss, right?
So Andrea's asking if her husband is a candidate for taking hormones. I'm not quite sure what she means by that, but I mean, what would you suggest to someone who had that kind of symptom list?
So first we would check the testosterone level, and if it's under 300, typically we would then investigate why is the testosterone low. Is it because the testicles failing to make the appropriate hormone, or the pituitary gland, which regulates testosterone, is dysfunctional?
Is that a simple fix, if that's what it is for Andrea, if it's low T or male menopause, and he takes the gel or the pill or whatever, all of a sudden
usually
all's good with the world?
Yep, usually it
Andrea, girl,
works very well.
Get him at least to check it out, okay? Get him at least check it out, right? That's probably the biggest thing, is trying to get them just to take that action, right?
Right.
Absolutely.
Yes, and on that, oftentimes with my clients, I see a lot of, the lifestyle issues that need to be changed, okay? She had mentioned that her partner was 30 pounds overweight. That's got to come off, okay? So, when we see that, obesity, individuals who are obese will have testosterone issues, okay? Lowers testosterone.
That's really interesting, because the warning signs that we're getting here, if you're at risk for low testosterone or what some of the causes are, these are things that we wanted people to look at. But the lifestyle change is actually what the next question was. It says, my husband insists that smoking and being fat don't contribute to his lack of interest in sex. Marilyn wants to know, is that true, or does he just not want me anymore?
I wouldn't say that he doesn't want her anymore. I mean, that's a whole, that's a problem that men who do have erectile dysfunction issues go through. So, but smoking and being overweight, we can all attest to on this platform that is absolutely a problem.
It's the number one thing that he can do easily to help improve his health. I mean, some of the other things are possible, but stop smoking. I mean, there's so many cancer-causing chemicals inside of it. It causes inflammation inside the blood vessel, and it damages the inside of the blood vessel. And so anywhere where there's blood, including the penis, you need blood for erection, can be damaged by smoking.
And of course, we mentioned alcohol, which Shakespeare said that alcohol creates the desire but takes away from the performance.
Yes.
Yep.
So
see,
keep
he
that in
knew
mind
what
as
he
well.
was talking about. This next question might go down in the annals of this show as my favorite question ever, okay? It says, and I'm not kidding, I am 86 years old. I'm in excellent health. I've never been impotent until the last 2 times I tried to make love. Why would this happen? Nothing has changed in my life. What should I do? And please don't say my name, but sign me frustrated. I want to say, you're 86. I mean, does he have high expectations of himself, or is it time to say you're 86?
You could certainly say you're 86, but older individuals are having more sex as well, and it's being more, it's more open when we look at those issues. But one of the things with erection issues is that with men is that once they have an issue, it's like they spiral out of control. Oh my gosh, there's something wrong, and men will have bouts with erection issues. It's part of life. It's part of sexual function. I mean, men are becoming more sensitive when things come into their minds. They can lose their erection. So there's all kinds of different things. So I would tell frustrated to relax and not to worry about it, and just go on and start thinking about, sex is pleasure, and enjoy yourself, okay?
And if it continues, I would have him talk to his doctor about it. It could be the start of high blood pressure. It could be the start of high cholesterol, which is the clogging of the arteries. So something could also be going on, and then as Dr. Block said, he could get tested for his testosterone to see if his levels have changed, because his hormones may be changing.
I just got
he
such
might
a kick out
respond
of it.
to any of the erectile dysfunction medications, especially if it's a mild problem.
I just got such a kick out of it, because I just love him. I just think it's so great that at 86 he's still interested, number one, and that he wants an answer so that he can do something about it. So I'm glad that you guys were able to give him some
We have to be forward-thinking. A lot of individuals, we always think people are, their life is going to decline at a certain age, but I have patients in their 80s and 90s, doing all sorts of interesting things that you wouldn't expect an older gentleman do how to do. So.
Someone in the studio said 86 is the new 75.
Really
So on that note, we're going to take a quick break. We'd like to know what the most pressing health issues facing you today are. So if you want to join in, or if you have a question or comment, or if you're 86 years old and being frustrated, we might give you some advice on how to handle that as well. We'll take a break. We'll be right back. Welcome back, everyone. I'm Lynn Doyle. This is It's Your Call. Our topic today is men's sexual health and health in general for men. We're doing this because once a year we say Happy Father's Day to all those men in our lives who are dads, but we're saying you should take care of yourself every single solitary day so that you get to celebrate more and more and more Father's Days. Now, this question comes from one of our viewers, and it says, I've been a smoker for 40 years. I don't think I can stop at this point. I do want to be healthy, but it's a major obstacle, not to mention a huge bone of contention with my wife, who was able to stop many years ago. Paul wants to know, what can I do?
He can stop.
Yes, he can.
There are people who have stopped after 50 years of smoking, and every year that you stop, your health improves. So it's possible, but he may just need help. So there's some tools out there. He can talk to his doctor about the pill, maybe the patch. There's a couple of different pills out there, but he can stop. Just be encouraged. You can do it.
Okay, Paul, we want to see you around for the next Father's Day, so please
Absolutely.
do whatever you can. This one, I think Maria actually directed it to Dr. Block. Can taking Viagra harm you if you have high blood pressure? My boyfriend won't take it because he does have high blood pressure and is afraid that there'll be a deadly combination. Can Dr. Block give me an answer?
No. That's
Can't
the
give
simple.
an answer? Or it's not a deadly combination?
It is not a deadly combination.
Okay. Phew.
If you take
I
it
thought he
with,
was refusing to answer.
if you take it with nitrates, which are used for coronary artery disease, that can be a fatal combination because of the low blood pressure that can be caused. But if you're just on ordinary blood pressure medicine, or you have hypertension, high blood pressure, that should not be a problem.
So those nitrates are
Maria, go have your boyfriend go to the doctor and see.
Those nitrates, it would be isozorbides. So if anyone is on that type of medicine, it might not quite say nitrate, then that would be an interaction, but it doesn't elevate blood pressure.
But she should encourage him to go to the doctor, and at least what his doctor says.
Yes.
We have one last...
People ask about nitrates in food, not a problem.
Okay, sure. So we have one last question that we couldn't put on the screen because the person who wrote in is embarrassed and did not want to be identified, but the question was about premature ejaculation. Says, can't talk to his doctor about it. Is there anything at all besides thinking of the pink elephant in the room that would help him?
Premature ejaculation is actually the #1 sexual complaint for males. It trumps ED, and it usually ends up being wrapped up in anxiety issues. So what I work with my clients on with PE is really learning control, learning their body's point of no return, learning breathing exercise. It's so interesting how we as people actually forget to breathe in a sexual situation, which then causes all kinds of anxiety. Norepinephrine releases, not enough anyway, or too much rather. And really all a person needs to learn is to control the anxiety.
Just
is the short of it.
Just do it. I was going to say, just
right.
What's the problem? Okay, so we've talked about ED, low T, and PE. I could do a commercial for myself here. If you have questions about any of these things or any of the issues that we talked about, including heart disease, stroke, unintentional injuries, these are all things that are at risk for men. You can email me and I will forward your comments and questions to the doctors. Dr. Patterson, I want to thank you so much for being with us. I hope you'll come back. And Dr. Block, you as well.
It's glad to be here. Thank you.
We always enjoy having Dr. Deb Leno with us as well.
Thanks.
Good to see you guys, and to all the dads who are out there, we hope that you have a wonderful day, and we hope that you will take our advice that we gave you here on the show today so that you can enjoy many, many more wonderful days with your family. Until the next time, my thanks to my crew and to you for watching. Good night.